Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Sinise. Nice to have you here. We meet every Saturday at 10:30 a.m. Central Time on YouTube, Facebook, and X, coming to you live at 10:30. We're always available on demand, though, anytime you want at our website, UroPatient.com. Best place to go to learn more about the show. Also, best place to find all those past episodes. You can watch them all anytime you want. And here's some helpful information. I've got a bunch of handouts available. Just go and visit our website. You'll find the handouts, and there's a handout that you can run off and take home for your own use. Today, we're going to talk about urinary tract infections, or UTIs, that seem to just keep coming back or won't go away. We'll look at why this happens and what you can do about it. Now, UTIs can happen when bacteria get into the urinary tract. This can be due to a variety of reasons, from hygiene habits to sexual activity. Now, urinary tract infections are primarily caused by bacteria entering the urinary tract, with E. coli, a common bacteria found in our intestines, being the most frequent culprit. These bacteria travel from the skin around the anus or genitals into the urethra and up into the bladder or kidneys. UTIs can occur due to various factors, as I mentioned: poor hygiene, sexual activity, urinary retention, not fully emptying your bladder, or if you're using a catheter, these type of things. Now, they also can be a result of changes in the urinary tract associated with aging or menopause. Women are far more susceptible due to the shortness of the urethra, which makes it easier for bacteria to reach the bladder. If you've been treated but your symptoms stay the same or come back quickly, it might not actually be a UTI. Sometimes there's another condition altogether that could cause this. Otherwise, sometimes it can be resistance to the antibiotics. Now, recurrent urinary tract infections are defined as 2 or more UTIs within a 6-month period or 3 or more UTIs within a year. To get to the bottom of a persistent infection, your provider may do some additional testing, like special urine test, or even scoping the bladder or doing a different type of imaging study like ultrasounds or x-rays. Now, antibiotic resistant, I mentioned that. That's when a bacteria no longer responds to the medications we use. It's beginning to be a growing problem because of the overtreatment with antibiotics. And there's no new antibiotics really kind of down the pipeline anymore, unfortunately. So it's critical to make sure that if you're given an antibiotic, to take the full course of the antibiotic, and don't stop it just because you're feeling better. Sometimes you knock down most of the infection, but the stuff that's left behind can then grow back to a new infection. Now, some bacteria that cause urinary symptoms may not be detected by a standard urine culture method due to their unique growth requirements or slow replication rates. Now, these are some organisms like uroplasma, mycoplasma, and certain anaerobes, which do not grow well or even at all in conventional culture methods used by most laboratories. As a result, patients with persistent symptoms or negative cultures may benefit from these advanced diagnostic techniques like PCR testing. That's that genetic stuff, folks, or specialized cultures to identify elusive pathogens and guide more effective treatment. Now, I invited Dr. Margot Lee from the Pathnostic Company to discuss a new test from their group that can do some of these things. Let's have her talk to you now.
So as clinicians, we're always looking at and meeting these patients that come back with these UTI infections, and they're symptomatic and very difficult to treat, high resistance. And so what do? So, of course, as clinicians, we start with taking their clinical history, understanding a little bit about their background. And then once we understand a little bit about the background about the patient, then we have to sit and start deciding about our diagnostic method. What do we use? Well, of course, there's many different things. There's UA, urine analysis. There is standard urine culture with AST, with antibiotic sensitivity testing. Now we're also moving into molecular diagnostic methods, and guidance UTI is a test that falls under, the molecular diagnostic test. It's a very unique test. We're going to talk about it a little bit today. And once you have that picture of the patient as well as using your diagnostic tool, then you can sit and decide now how you want to treat this patient. So to start off with, I wanted just to review for the audience about the guidance UTI test. And this is a unique proprietary test that is made for that symptomatic, recurring, very difficult to treat UTI patient. And it's a two-part test. It uses midstream voided urine or catheterized urine or bladder wash. And so we'll take those 3 sample types and we will first run a PCR test where we're looking at a very small, clinically focused group of organisms that we know that are the ones that are the uropathogens that we see in the bladder. And so we'll look at do a PCR to identify that they're there, if they're there. So we have 26 organisms and 3 bacterial groups that we want to see if they're there. And then we'll also tell you the presence of any resistance genes that are there. And we look at 32 resistance genes. So that's the detection part of it. And that's that genotypic detection that we need to see what's there. And then next, we'll take that patient sample and we will run a pooled antibiotic susceptibility test where we take that sample with all the organisms together and we want to have all the organisms together and run susceptibility testing because we know that when these organisms are in the bladder, they can modify antibiotic resistance. They can communicate with each other, try to protect each other when antibiotics are given. So we do not want to look at them as isolates that standard urine culture does. We want to look at them all together. So that is a pooled antibiotic susceptibility test. And that's what makes the guidance test so special. So what are some of the patients that you would use this test for? Well, symptomatic patients that, of course, have a reoccurring, persistent, or a complicated UTI. Patients that have some type of elevated risk, they're immunocompromised or the elderly. Once maybe you have a patient that you don't know whether this is actually a UTI or whether it's interstitial cystitis. And you could figure out whether the presence of organisms, pathogenic organisms that are there or not. And so you could actually rule out IC with this test. And then also if you have a patient that has a lot of antibiotic allergies, hypersensitivities, it would be a great test to use just to give some choice on an antibiotic that would cover the organisms for a patient that may want to try to avoid certain antibiotics.
So we're going to talk a little bit more about this pooled antibiotic susceptibility testing, or they call it PAST. It's an advanced diagnostic method designed to improve the detection and treatment of complex or recurrent urinary tract infections. So unlike our standard urine culture, which isolate and test a single dominant bacteria strain, the PAST analyzes all the bacteria present in the urine sample simultaneously, providing a more comprehensive view of the entire microbial community. So again, that might be why your sample's not responding to the antibiotic, because they're taking these individuals. I kind of say it's sort of like these multiple infections are like 3 gangsters fighting over turf, each with their own strength, weaknesses, and weapons. But instead of harming each other, they sometimes team up to cause even more trouble. In a urinary tract infection, when multiple bacteria are present, they can interact in complex ways. One may resist an antibiotic and protect the others, or they may communicate and form a biofilm, a slimy shield that helps them all survive. Just like gangsters dividing up territory and working together, when it benefits them, the microbes can share resistant genes. This is something new that we found out. So they hide from the immune system, making the infection harder to detect and treat. That's why understanding the whole group together through this pooled antibiotic susceptibility testing is crucial for finding the right treatment. And again, that's not the way we did it traditionally in the past. You would go ahead and just take and get the organisms. Even if there was multiple organisms, you would test them separately to see what antibiotics would work on them and try to find out which ones worked on them all. And I'm going to get Dr. Margot Lee to come in and kind of explain that a little bit better, how they do their test.
And so this is just a nice schematic. I thought I would show this is that you can see on the left-hand side that they will take a dish with that patient sample, and this is a standard urine culture, and they'll take an organism out, place it in a separate dish, and then determine susceptibility to each one in isolate. And on the right side, that is our pooled antibiotic susceptibility, and that's what guidance is that we're taking all the organisms, all the colonies, we're putting them together in a liquid media with that antibiotic and determining susceptibility that way, so that the antibiotic and all the organisms, all of them are all moving around. So you're capturing all of them together. And it's a more comprehensive view to look to see what these organisms are doing, and more like what the environment in the bladder is in your patient. And so I thought this was a nice update from our laboratory, is that we just showed a picture of an agar plate where you have an organism that grows in these colonies. So this picture I thought was fun for us to show today is that you can see on the left-hand side, that is the master plate. And that we'll say that's E. coli growing, and you can see all the colonies. And you can see that the next plate over, in that agar, we added an antibiotic. So we added piperacillin tazobactam. And what we did was we took a piece, it's called replica plating in the laboratory. We took almost like a piece of velvet, and you stamp that master plate, and then you go to the next plate and stamp that plate. So essentially you're trying to make a replica of those organisms at the next plate. So you could see that we stamped the master plate, and then we stamped the piperacillin tazobactam plate. And lo and behold, you can see that each colony continued to grow and made an exact duplicate of the master plate. So we can say that those colonies were all resistant to piperacillin tazobactam. It kept growing. Now look, if we do this again and we stamp that master plate and we go to the next one, which was 2 over, that's nitrofurantoin. And when we stamped that, none of it grew. So we can say that was 100% sensitive to nitrofurantoin, which is fantastic. And then the last plate I wanted to show you is we stamp that master plate and then stamp the Cipro plate. And lo and behold, look what we have here. As you can see that some of those colonies grew and some of them didn't. And so now we're starting to understand that in that master plate, that there is different resistance among all those colonies. So there's some sensitive and some resistant. And this is really significant, because when you're doing a standard urine culture, I'm going to go to that master plate and I'm going to choose 3 of those colonies to transfer to another plate to run sensitivity. So out of those 3, which ones did I choose? And so this is now becoming something that we're talking an awful lot about in laboratory space.
So yeah, there you have it. It's kind of, I think she did a great job of explaining it, but by not just taking samples of the bacteria, getting the whole thing and doing a replica and then testing it with the antibiotics, we get a better idea. So recurrent urinary tract infections have profound emotional and psychological impact on those who suffer from them. Constant discomfort, frequent trips to the bathroom, and anxiety about when the next infection can strike will lead to things like chronic stress, sleep disturbances, social withdrawal. Many patients feel frustrated, helpless, even ashamed, especially when the symptoms are dismissed or when repeated treatments fail to provide lasting relief. This ongoing struggle can erode confidence, strain relationships, and interfere with daily activities, work, or even intimacy. Over time, the emotional toll can be debilitating, as the physical symptoms highlighting the need for compassionate care, accurate diagnosis, and effective long-term management. So don't despair if you're struggling with recurrent urinary tract infections. What might seem like a repeated infection could actually be a missed or undertreated infection. Real important. Standard urine cultures often fail to detect certain bacteria, especially when multiple organisms are involved or when they form these protective biofilms. The good news is that The newer diagnostic tools like these pooled antibiotic susceptibility testing, or PAST, offer a more advanced and accurate way to identify all the bacteria present and determine the most effective treatment. So these cutting-edge tests can uncover hidden infections that conventional tests missed, helping you and your healthcare provider find answers and relief after months or even years of frustration. I can tell you, I've been in urology for 40 years, and I've had patients that keep coming back with infections in our practice, and before these tests were found, and they really kind of got, really dissatisfied with the care they're getting almost because we couldn't fix them. They're like, what's going on? Did this test to find out that there was a bacteria that we were not identifying. Treated them appropriately, suddenly the symptoms went away. So let's take advantage of all these great new tests now. So I'd like to thank you for joining us on this episode of UroPatient, where we explored the challenges and hidden causes behind recurrent urinary tract infections. If you're living with persistent symptoms, remember, you're not alone. And there are advanced tools and supportive care options that can make a real difference. Don't give up hope. Be your own advocate and work with a provider who listens. Important. Join us next week as we dive into more tips that can help support you every day. Until then, stay informed, stay empowered, and take care.